All right. Hi. Welcome back, everybody. Welcome back to the Aesthetic Angle podcast and YouTube channel. We are Monarch Plastic Surgery, Skin, and Wellness. Today's episode, well, first, let me just say I'm Dr. Paul Leahy, one of the surgeons here, and I'm joined by two of my wonderful colleagues today. We're going to have fun today. We're going to cover a bunch of different topics related to cosmetic surgery of the breast today. And so to my left, I have Dr. Alexi Sampath. She is our newest partner here at Monarch, and her wonderful nurse, Katie Murphy.
Hi.
And Katie grew up in town here. You went to St. Teresa's?
Oh, Scion.
Darn it, I ruined it. Oh, sorry. And then you went to Creighton for nursing school, and then you've been back and you did some pretty high-powered cardiac nursing and things.
I was a step down from the CVICU at St. Luke's on the plaza for about 12 years.
Nice. And you still occasionally do a
still
little bit
per
here
diem
and
there.
So.
And then to keep up my skills,
Yeah.
And then as soon as Dr. Sampath was hired, I came along with her.
Yeah. Yeah. And so I've always wanted to ask you this question. I'll just ask it now on camera. So like the cardiac nursing world is intense. I mean, life and death, EKGs, monitors, all that stuff. And then you come here and we don't have any of that kind of stuff, but it's emotional, and emotions are maybe not, but maybe a little bit more heightened here, and how you function as a nurse is using your other skills.
Right. I think especially with the breast recons, I was never an oncology nurse, but just seeing them go through it, especially when you get the young 40-year-olds and even younger than that who have small children, and kind of helping to navigate that, I feel like that's when I've had the most heightened emotions when I've been here.
Yeah, breast reconstruction after cancer is one of the things that is not talked about that much in terms of like, you hear about, Breast Cancer Awareness Month is October, but those kinds of things are just not discussed as much. And there is a huge part of what people go through.
I will say when I started, I mean, you always think plastic surgery, the cosmetic side. I never realized how much hand was involved getting into it or thinking about breast reconstruction. So it's been a good learning.
Yeah. Yeah, we do a fair amount of hand surgery too. And Dr. Sampath had amazing training at Southern Illinois University. And you've just been hitting the ground running. I mean, it's been such a joy to have you and to join our team. And I'm in my 18th year, and I love having you here because I get to learn new things too. Like, because we were just before we turned on the cameras, we were talking about kind of a tricky case sometimes in breast surgery where women are born with asymmetry. So left and right, sometimes significantly different, and how you approach that, particularly young women, and it's always tough for me whenever I've had to deal with those, because you find that some of those women are not participating in life anymore. They're like, they have to wear certain clothes. They won't swim. They won't go here and here and here. Just with a little work, we can make that so much better.
I agree.
And so anyway, it's fun to chat with you about new stuff and what's up and coming. But well, kind of one of the things that we really wanted to get into today a little bit and spend some time with are cosmetic breast surgery specifically. We brought along some sample breast implants we can talk about. We've done that on some other shows too. But, I think we can talk maybe a little bit, get into the concept of what does it mean to do a breast lift by also adding a breast implant. What is a breast lift and what that means, and how difficult it is to describe to somebody what that is, So I guess maybe we could talk about that a little bit. I'd like to ask you guys as a team, kind of just getting up and working together and stuff. When you meet a patient for the first time, a lot of times Katie will likely meet the person first, and they're going to talk to you about some of their concerns. What are some of the things you hear from your cosmetic breast surgery patients?
A lot of it is post-pregnancy. They're finished having babies, and you get some ptosis, especially if you are breastfeeding, and then loss of volume, or when people are having massive weight loss, and then you're having that ptosis again, loss of volume, and so which will bring in either wanting an implant, the discussion of having an implant versus a mastopexy.
So we kind of suss out their goals. Do they like the volume that their breast is, just not the shape and the position of it? Or do they wish their breast had more volume kind of at the top, which is the role of an implant? So Katie does a good job kind of figuring that out from the get go, and then we fine tune like what kind of implant or projection and everything.
Hmm.
So once we figured out if they need an implant based on their goals, when the implant is in, will their nipple be in the right spot, or does that need to be moved up to a more youthful position, and kind of reshape the breast with that? Or maybe they don't have a lot of skin, and so just the implant will do it alone.
Yeah, and so you get into this little debate in your head too,
Yeah,
as the surgeon and nurse team, like, okay, well, all right, how big of an implant do we need to solve this problem without the breast
right.
lift, and
Mm-hmm.
is that a good way to go?
Yes.
Particularly if somebody's looking for more of a petite size, just want
Mm-hmm.
the aesthetics, So it is tricky. Um, can you walk me through a little about what goes through your mind then when you walk? Katie mentions, okay, this gal is interested in a breast implant, basically breast rejuvenation. Let's just
Mm-hmm.
call it that after pregnancy or even massive weight loss, which we see a lot more now.
Mm-hmm.
Um, and you walk in, you're going to have a conversation with her. Maybe walk me through some of the things that you would kind of introduce them to the topic with.
Sure. So, like I mentioned, I want to know, do you like how your bra cup size that you're already wearing is filling out? Yes or no. That points implant or no implant. And then, based on that, everybody has a different ideal aesthetic breast. So some people want to be a little more like, dramatic and they want to have more fullness, etc. So I like to know what their goal is so I can be on the same page as them. And then aside from that, as far as their history, if they've had fluctuations in their weight, etc., that makes me key into maybe using some different tools in the toolbox. So we have like absorbable mesh that we can use to kind of help keep that lift in place and support the implant. Um, yeah, those are the big things.
Mm-hmm. I don't have much experience with the mesh.
Mm-hmm.
Maybe you could talk about that a little
A
bit.
little
What
bit.
your yeah.
There's several different brands, and then also makeups of the mesh, and the premise being that they give a little bit more of a scaffold and support structure to the soft tissue, and then your collagen and scar tissue will grow in and just be a little bit more, as I said, supportive to the implant. Even if you don't have an implant, you just have a lift, it can support your own breast tissue. And then over several months, it dissolves and leaves the stronger tissue behind. So, I've also heard it called like internal bra or something to that, to those effects. But yeah, it just helps have a little more long lasting results. There's debate of when to use it. So, in my training, we didn't generally use it for the primary surgery or the primary augmentation. Some surgeons do, and they have good results with it. For me personally, whenever someone's been massive weight loss, so their skin's not quite as strong, or if they're a revision, so they've already had implants in, the weight of the implants and just aging has caused them to kind of come down. Mesh might be a good use for them too.
Okay. Yeah, one of the things I've noticed is that what you see at day one
Yeah.
is going to be different at day
Mm-hmm.
7,
Mm-hmm.
and then certainly year 7.
Yes.
All
Yes.
that stuff goes on and things just change. And uh, I wish as plastic surgery, as a specialty, if you could know that ahead of time and predict that ahead of time, like
Yeah.
who was going to have what we call bottoming out. In other words, whose implant was likely to settle lower than would be ideal, and more than you even thought.
Mm-hmm.
And I agree. I think that particularly with massive weight loss, you'll tend to see that the tissues just don't have quite the resilience or the
Mm-hmm.
support, and so maybe that affects your implant choices, and then some of the other techniques that you
Right.
use and stuff too. Um, One of the things I was kind of see if we could tease out a little bit would be your idea of what the perfect consult would be. In other words, if you could you guys walk out of the room together later in the day, and you're like that went really well, or you know what, that I think I confused the patient by saying this. I need to
Mm-hmm.
reword. I need to change my
Mm-hmm.
wording.
Yeah.
If you guys gotten a little
Because
hang of
there
that,
are so many different, like within the augmentation and lift console, it's like, do you need implants? Do you don't? Do you want your implant below the muscle or under the muscle? Do you
mm-hmm.
want silicone or saline, etc.? So there is a lot, a
Yeah,
lot to digest. I agree.
I think
Um,
the breast augmentation, that console is can be kind of intimidating and overwhelming compared to any other surgery that's offered just because I feel like a lot of the surgeries are pretty straightforward of like, I mean, you can do different techniques, but this is like you were talking about, once you get into the implants, there's so many different brands, different sizes, different projection. Do you want teardrop? Do you want more round and full? And so, and like people don't want to have what's the,
Buyer's remorse. They don't
right.
want to
Yeah,
regret
sure,
it.
They
Yeah.
sure.
want to
And
make
you don't
the
want that
right
And you don't want to go
decision.
back. You want to
Right.
make the right choice.
Completely.
Yeah.
Right. So it can be very overwhelming,
Yeah.
I feel like,
I
for
agree.
them.
We do have, you know, we'll have them try on the implants kind of in a little sports bra so they can see how it would look beneath clothes and kind of get an idea what that volume might look like on their frame. And then also the software, the Chrysalic software, where you can use their picture and kind of see in their anatomy what the implant might look like. You can add lift to it too, so they
Yeah.
can at least get an idea. And it also helps us play with specific implant sizes.
Yeah, I agree. I really like the software. But having someone try on the implants in a sports bra and a shirt gives you at least the feel of the weight almost
Yes,
too, which is
yes.
nice. Is that's the actual implant, you know? A
That's
lot,
my favorite
you'll get
part.
this. How much is this? Are they this heavy?
It is, but it's my
Yeah.
favorite part because that's when people are like laughing and smiling. They're kind of relaxed. They're like, "Oh, this is what like I would actually look like," and like having breasts or make you more feel more feminine.
Yes.
Like they get a big smile on their face, and it's fun. Like I walk in with a whole armful
Yeah, I
of
know.
different implants, and it's like, okay, let's get after
I know.
it.
Maggie does that too. I'm like, let me help you with that. We got a box full. You know, you guys may not know this. We were one of the few practices in the country. This is a while ago when Chrysalix, this 3D software we're talking about, kind of came out. We had this full length mirror, and we never really got it to work, unfortunately. But the idea was that you could stand in front of it, and it would simulate with the implants, you know, kind of on you.
Sure.
And they had some demos of it, and it was really cool. We just could never make the darn thing work right. And so then it became a big paperweight, and
Oh my gosh.
it was huge.
Yeah,
But darn it, you know, that would have been kind of fun
Even
to be able
thth
to have.
simulated pictures are pretty nice.
Yeah.
Yeah, they are.
They are
They are
good.
really good. And I usually will try to. I don't know how accurate they are, but the software can like put like a swimsuit on you, the model.
Oh, we
and
haven't
stuff
done
like-
that.
I
Oh,
know,
it's
we
pretty
haven't
cool.
tried that.
Yeah, I like
Katie
that
didn't
actually.
put a little part.
Camisoles or a full
Completely.
t-shirt.
You can change the color of the shirt. It's so silly. But anyway, I can show you more about that later. It's pretty fun. Let's see. So before we started, Dr. Sampath and I were talking about a breast lift. And so the medical term for that is called mastopexy. And so masto, they're both Greek words. Masto means breast, and then pexy is to lift or to kind of pin up, basically. But describing to someone what you're actually doing is hard. It's almost like me trying to tell you how to tie your shoe in just words. You know, it's. Do you have you thought about that? I mean, not to put you on the spot, but it's a.
Yeah. I think that the concept of like the nipple on a pedicle is hard for a lot of people to understand who haven't, even people in the medical field who aren't in plastics. Because like my husband's in the medical field, and I don't think he quite gets it when I try to explain it to him. But essentially, you know, when we're doing any kind of breast surgery, we want to preserve the blood flow to the nipple. That's like top of the list. So with the mastopexy, there's different types of pedicles, etc. But depending on the type of incision you're doing, you have to preserve that, and then you're just you're repositioning the tissue kind of beneath it and around it, the nipple being it.
Yeah, I know.
To get it up.
Yeah, it's hard.
Yeah, and I mean, there's different techniques. So depending on where you want your blood flow from the nipple, you can excise some breast tissue. So a lot of times people need, it's called addition by subtraction, but in order to lift it, you have to take some of the weight off the bottom of the breast so that it can kind of have that more superior placement on the chest. So I don't know
I like
even
that.
where it was. Yeah.
That's good. As I've noticed that too, because early on, you know, in my practice, my training, we didn't do a lot of mastopexy, so breast lift, and implant placement at the same time. We just usually they were staged or done in separate, but it can be done.
Why
Well,
is that?
It's just kind of competing forces. So
Yeah,
like
exactly.
You're putting something behind the nipple, but then you're also trying to like cinch it up. So
Okay.
you wonder, there's pressure on different angles and you want the nipple to survive. And also it's hard to predict your implants in there. And now you have to kind of shape something around it,
Does it make
Yeah.
it harder
Multiple
with an
steps.
implant in to then do a mastopexy afterwards?
Just
I
another
don't think so. I think it's
step.
okay,
Yeah.
just another step.
Yeah.
But it's interesting is we were I was talking to John, one of the surgeons, joined us in the fall, and he was saying where he's training, they actually do the breast lift, like in that surgery, they do the breast lift first, and then put the breast implant in. Most of us
Oh.
do that the other way around. You put the
Yeah.
implant in first, shape the tissue around what we call the breast mound, kind of the shape there. It was kind of a clever way of looking at the same problem,
Yeah.
which is fun about plastic surgery. They'll try all kinds of new things and stuff.
Is it easier to do if you do the mastopexy after the implant? Does it matter if you're doing over the muscle or under muscle? Is the mastopexy easier one way or the other? Or no?
What do you think?
I don't know that it would be. I have always done it with the implant first and then the mastopexy, so it's hard for me to say what order is easier.
Yeah.
I'm only really familiar with
But
one.
over or under the muscle,
Oh.
one's not easier than the other. It's about the same.
Not necessarily. It
Okay.
kind of depends on if you're just doing skin only, which is like a pure mastopexy, just no breast tissue off, it probably wouldn't matter at all because you'd
Yeah.
never see your implant again.
Yeah.
But then
Right.
if you have to take a little bit of tissue out because they're like more heavy on the bottom, but even then, I don't think it would
Right.
really
I haven't
change
noticed
it.
a big difference with
Yeah.
that necessarily. Um, so let's see. So you saw a patient for who wanted augmentation. So she's looking for more volume, particularly at the upper portions of the breast, usually, or at the inner part, like the cleavage. People rarely say that they want more volume on the sides, although they sometimes do. I mean, that kind of that look. And then usually you're having to use a bigger implant to get there. But you've also determined that even with that implant in place, the nipple position is still going to be low. So so we're talking about doing a mastopexy, a breast lift with an implant. Um, so Katie, can you tell me some of the things then that would be on your mind when you take over for like the pre-op teaching? What would be some things that you would like our audience to know about preparing for that day, preparing for the first week, first month?
So pre-op teaching mostly going into your post-op care. We don't want you to do any strenuous activity for at least 2 weeks. Anything that's going to raise your heart rate or your blood pressure just to prevent any unnecessary bleeding or increase in swelling. No, lifting, pushing, pulling, more than 10 pounds for at least 2 weeks. And then you're just really listening to your body. You know your body better than the rest of us do. So you don't want to put anything that's going to put any type of pressure. You probably want to back off a little bit. And then they can expect that we like to see them about 24 to 72 hours after their surgery. They'll be wrapped up in an ACE bandage. We'll take that off. After that comes off, they can shower. And then we'll help them into a little sports bra, little zip on it that just helps compression there. And they'll wear that for 4 weeks total. For 2 weeks, we like them to wear it 24/7 except for when they're showering. And then after that first 2 weeks, just during the daytime.
Okay. Yeah, that's almost exactly what Maggie and I do too. Just everyone has little
Yeah.
different recipes and achieve the same goals and stuff like that. Have you had some people that have not followed your rules?
No, not yet.
Pretty good
Okay,
about
good.
Yeah.
it. Sometimes the compression's a little annoying.
Yeah, I
for
bet.
people.
At nighttime
They
especially
try.
and stuff.
I know.
Yeah.
So I'm like, you can take a break. I'd
Yeah.
rather you sleep.
That's what I say
Then,
too,
yeah.
exactly. Get sleep is important.
Yeah, for
just
healing.
if you're just miserable, okay, take it, take a
Yes.
break. It's
And
not
then
gonna
sometimes I feel like if we don't see them 24 hours, they're pretty. I know we had somebody who is like would refuse to touch the ACE wrap. They did not want to take the compression off
The
themselves.
holy ACE wrap.
Yes.
Right.
Yeah.
They didn't
Yeah,
want to
that's
take
right.
it off themselves. So she was like, I have not showered for 3 days. I was doing a little spit bath, but she's like, I was not about to touch this. This
Okay.
is all you guys.
We got
I'm
you.
like, that's fine.
We can take care of that.
Yes.
Come on in here. Yeah. So Jen Parker Quinn, our marketing director, helps us to generate, questions that she hears and things that because we're so close to it that we may not think of, like the audience might like to know of. And so one of the things that she was kind of putting forth to three of us was myth busting a little bit.
Oh, yeah.
So, still today, some myths that we hear, or patients come to you and before you even talk, and they have a list of things that they want to know about XYZ because they've heard this happened. I'll just start. And
Okay.
just one of the things that I've kind of noticed. One is, I was telling you about this before, is that even sometimes after breast lift surgery, people say, well, did you take my nipple all the way off? And you sewed it back on in place? That really looks good. And like, well, usually you don't do that. Usually it stays, like you
Yeah.
said, it stays attached to our body so that the blood vessels are still connected and hopefully the nerves are still connected and give you, sort of return to as near normal sensation as you can after surgery. Um, there are some extreme cases where you might do that. That's called free nipple grafting. So at the beginning of the operation, we physically do remove the nipple and the areola. You put it in a little gauze and then you shape the breast and you sew it back on. That's called a skin graft. It definitely is an inferior way to do it because you're going to lose the sensation. The height of the nipple can collapse, the color can change. But if you need it, you need it, and that's maybe the only way to do that safely. Because the alternative would be if it just wasn't going to work and wasn't getting enough blood supply, the nipple wouldn't survive. You'll die. And so, anyway, that technique sometimes needs to be used. It's fortunately not as common in the cosmetic realm, but like with our breast reductions, we
Sure.
may see it sometimes. Anyway, I think that's one. And I still get a fair amount of myths surrounding breast implants themselves, and we don't need to dive too much into that, but anyway, I can talk more about that later if you want. But it's, like, for example, that breast implants cause some kind of illness and those kind of things, and we can touch on that. But
Yeah.
what about you? What do you think?
One thing that comes to mind is I think there's a balance between scars and shape. And sometimes people are very keen or they've heard something that they need to minimize their scars for their breast lift, etc. And kind of similar with augmentation because there are different, like kind of non-traditional augmentation incisions as well. And I would say to bust the myth is I think that scars, unless you form like keloids or some unfavorable scar, right? That aside, you should accept the scars that are necessary to get the best shape of your breast. So that might be the inverted T because it gives us more control in horizontal and vertical directions, versus someone's like, I just want an incision around my nipple. Well, with that, it's so much less powerful. As a surgeon, you might need to let us have more scars, and we can give you a better shape of your breast.
Yes.
Does that make
Oh,
sense?
yeah, completely.
So, and I know like sometimes people will want to do, like I said, just around the nipple to put their implant in or kind of in the armpit. That limits us a little bit of like what kind of implant you can use if it, saline or silicone, etc.
Yeah. And later, you discover it's rare to meet someone that's unhappy with
I know.
the
The
scar
breasts
itself.
scar
Yeah.
very well generally.
Yeah. And like you say, there are some exceptions, and then maybe there's some treatment for that. But
Yeah.
by and large, people would make that, particularly like in tummy tuck surgery. Then,
Yeah.
for sure, you're like, oh, I don't want this such a long scar. I'm like, yeah, but the longer it is, the more tissue you can remove. So, yeah, that is a good myth. Do you have any, Katie, that you've come
So
across yet?
we talked about this a little bit as far as implant sizing. Like, I think you kind of think that you can just put any size of implant on any body. But when you come in for a consult, we do measurements, and one of them is the width of your breast. And so you can only do so small or so large based on that measurement.
That is a good point.
Yeah, it's not a free for all.
Yeah.
There's some rhyme and
There's some
reason.
window there that's going to work well. I guess one other thing I just was thinking about was that, I feel like almost every day that I work and see a new patient interested in a breast implant, we're always kind of working against that old myth of the kind of the silicone implants from the 90s, let's say.
Yes.
That, and just for example, I mean, this is one of the more modern breast implants that I have in my hand here. And if you had one from the 90s, they actually look very similar. I don't know that you could tell just one quick glance. But the main difference is in the safety. I mean, you can chop this thing in half with a knife, you can squeeze it really hard, run over with your car. I've done it. When you pick it back up, it basically is the same shape. It's what people refer to as a gummy bear material, almost like a jelly bean, whereas the older silicone implants, it is messy. I mean,
You
you
see it
take
when
out,
they're ruptured.
yeah,
and you have to
exactly.
Take them out. Yeah.
It's unfortunately we still see
messy.
that, and I mean, the longer we work, the less that will happen,
Sure.
which is good. But yeah, I mean, I don't know that you can get all that silicone out if that from those old style of implants. But I mean, today's versions. I mean, I'm sure like you, and I've gone to do surgery mainly in like breast reconstruction patients I've had with one of the more modern implants, and you go in there and you didn't expect that the thing had like a little cut in it, but you can just take your thumb and your index finger and take it out, and there's not a trace of silicone. I mean,
Right.
it's been in there for 10 years or more. So anyway, the safety of breast implants, the technology has gotten so much better. Um, but anyway, I think that's something we'll always probably battle a little bit of that conversation.
Yeah, I agree.
Do you? Well, since I brought it up earlier, what would you say to a person who said, I'm worried about, could my implants harm me in some way
Oh,
medically?
sure. So breast implant illness, which you're alluding to, there's ongoing studies, first of all, trying to pinpoint. There's a lot of stuff on social media, I would say, but ultimately there's no test to diagnose breast implant illness. And there's no, so there's no like diagnostic gold standard. So we kind of just have to go based on, they have these vague symptoms, brain fog, joint pain, fatigue, etc. They can first go to their PCP and make sure they have a workup. They don't have thyroid problem or some other type of imbalance that could be treated. But ultimately, the patient, if they want to have their implants out, they can have them out. And I've had people who say, I feel better now. Now, I don't know if that's placebo. I don't know if, right, I don't, you'll never know.
Right.
But it is the patient's body, so they decide to have it in, they can decide to have it out. Like I said, there's no hard science or test to prove it though. So it's interesting with counseling.
Right.
And anytime that someone is going to have an implant put in, I think they should be aware that, because if all you have to do is Google it and it'll come up. So I'd rather they hear it from me, that it is something that some people experience, and they ultimately get their implants out.
Yeah. I was just looking at this before we did this, just so I could see what the latest was. And I came across, I was reminded by a podcast by our former colleague, Dr. Regina Newhan. You should check it out. It's called Plastic Surgery Decoded. One of her more recent episodes had the president-elect for one of our big plastic surgery societies called the Aesthetic Society. And so she was talking about in her patients with the newer modern implants that, I mean, they're not carefree and they're not lifetime implants,
Right.
but we're getting better and better and better all the time. And there's still to this day, she made the comment that there really is there's not a true medical diagnosis of breast implant illness. It's talked about all the time. Matter of fact, it's been talked about since the early 60s when implants first came out. Yeah. But we don't have, like you mentioned, there's not an x-ray you can order or a lab test that would say yes or no, this is what you have. And then because of that, you don't know what the treatment,
Yeah.
But like you mentioned, you can take them out.
Right.
And
it's drastic, but if it's,
yeah.
Yeah.
I feel like people don't even, like you said, it's readily available on the internet, but people don't even notice those symptoms until you bring it up. And you're like,
Yeah.
have you been feeling fatigued? And then you go down to the list and like, oh yeah, yes, yes, yes. And had no correlation with the two.
Yeah.
It's hard to.
Well, any symptom you ever dreamed up has somehow been attributed to a breast implant. I didn't have that before, that kind of thing. And so, it's tricky. But, well, let's see. Can you give me some other advice about anything that you would say? Like, let's say you see a patient on your schedule coming up for cosmetic breast surgery, that maybe some good questions that they would come with, that you've gotten? Anything that surprised you or?
I don't know.
Well, that's good. That's good.
I think it's kind of, I guess going into it, I kind of like, because we were talking about earlier, that it is kind of intimidating. Like it's overwhelming how much information there is that goes into that consult. You don't want to overwhelm the patient. So it's kind of gauging to see how much research they've done on their own, to see how far along they are in the process of if they know what they are looking for, or if this is like, we are just now talking, getting
the information.
Right.
Yes.
Yes.
Not having surgery tomorrow.
Right.
Yes.
Yeah.
Versus some people are like, I want above the muscle.
Right.
Yes.
They've done their research.
Or they bring pictures.
Right.
Yes.
That can
Which
be
is very
pictures are helpful, but
yeah.
it's kind of like I say, like when I bring pictures to my hairstylist, you got to pick like someone with a similar frame or etc. to keep your translation of those photos to being realistic.
Yeah. Okay, so a tricky question. Okay, this is sort of a can be an emotional one. Somebody comes back. It doesn't have to be just for breast surgery, but since we're talking about that, and they are dissatisfied with their result in some way. The size doesn't feel like I wanted it to. Like you mentioned, the scar. I don't like my scar. Left and right sides are different. Those kinds of things. It's a very very challenging part about what we do. Um, can you walk me through how you would approach that?
I would want to make sure like totally understand exactly, like objectively, what's bothering them. It's natural to have some asymmetry between breasts, which I try to point out before surgery because no one, looks in the mirror as much as after you've had a surgery done because you want to watch your healing and all of that. So you might notice asymmetries more afterwards when you're more, focused in. But yeah, we show them, like before and after. If you already had some asymmetry, it might be normal to still have some. As far as the scarring, I mean, if they had like, pathologic scarring where we could do an injection or something to soften it, versus if it's just the amount of scarring, counseling that'll fade over time, and we'll do talk about scar care and all of that to optimize the scar. Um, Implant size, it is tricky. We do all those things before trying on the implant, using the chrysalics to try to pinpoint exactly where to be. But obviously, it's not something you can change after it's in. You can always do a revision and take some if it's a problem of excess skin or some of their own tissue. You could remove some of that if they wanted to go a little smaller. Now to be bigger, potentially you could do fat grafting if you didn't want to exchange the implant. So there are some options afterwards.
I think
Yeah, a lot of it's
time,
addressed pre.
well, time plays into it too, right? Because
Yeah,
how
for
long do you
sure.
have swelling? And I think it's a lot of reassurance that gotta give it a little bit of time before you're gonna see your final result, and then kind of go from there.
Right, and the implant will kind of settle down into place,
Yes.
and generally it looks better. Sometimes people really like the fullness of the
Right.
swelling,
Yeah, there is that too.
so
Yeah.
there's that to contend with. But
Yeah.
yeah,
I always tell my patients about who are liposuction patients. So for that's all you're having is some liposuction. Let's say just of the trunk or the tummy or something. It's like, well, a lot of people can see a small difference at day 1, 2, 3.
sure.
Small. But usually, even up to 3 months, I've noticed people are still not really trusting me very much, like because you spent the money,
Yeah.
you had the operation, you usually don't hurt anymore by that time, by 3 months, it may feel a little funny. Um, but yet you're wearing the same clothes and no one's noticed it and, those sorts of things. But for something weird happens, especially with liposuction between the 3rd month and the 6th month, I feel like, and by 6 months, once you take some pictures, that's when patients are like, oh, wow. Kind of forgot, like you mentioned the time, Katie mentioned the time, a little bit about how much the difference that is.
Yeah.
So,
And I think that's a good, kind of will tie back into the consult of like you want to make sure that the patient and the surgeon are comfortable with each other, that you both have a rapport and a trust in each other, and I think that will kind of help alleviate anything post-op, or at least help a little bit.
oh, absolutely.
Yeah.
Yeah. And, I mean, it's just like meeting anybody in the world. Sometimes it's just not really a good fit. I might have said something that caught them off guard or something like that. And maybe if I didn't even mean it that way, or they sometimes people will internalize one word that you say as the surgeon, and that's the kinds of the kind of the holy grail or something. But, and so maybe it's not a good fit. And,
Right.
but there's, obviously many people that you could see that would help you, but
Yeah.
when it is a good fit, it feels right, and
Yeah.
that's getting back to that perfect console. Like, oh, but this is going to be a good case where we both understand what we're going into and where we're headed with this and stuff. So those are fun. That's why we do our job, right? It's
Yeah.
fun. So, okay, an easier question. What's for dinner? What do you do at dinner? You have a young little son
I
at home.
do. I do. Yeah.
Does your husband beat you home
Oh,
from
yeah.
from work? He
Yeah.
does. Okay. He's a
He has
dermatologist.
nice schedule. I know he even has like a 25-minute commute, and he still.
Oh
keeps me
gosh.
home.
Okay. Great.
He's a good cook though, isn't he?
He is.
Well,
Yeah.
what will he make?
I don't know what's on the
It'll be a
menu.
surprise.
He's been making some different salads. So we got a New York Times like cooking subscription. And
Okay.
so he's been trying different recipes to mix it up a little bit. So the different salads. He found like a grilled chicken. Apparently you put like mayonnaise on the outside. That's in the marinade and it helps it maintain moisture. I don't
Okay.
know.
All right.
It's
Sweet.
very
That's great.
good.
That's
So
great.
hopefully it's that.
That's good. Yeah.
Also, my mother-in-law was just in town and she made some food for us to
She
eat.
hooked you
So
guys up with some stuff. Good. Katie, what will you have on a Tuesday?
I'm just probably gonna go over to
That sounds
Dr.
pretty good.
Spaniel
Yeah.
or to
Oh
your
yeah,
Dr.
that'll work too.
Sampath.
Yeah.
They live so close by, so
Yeah.
like, what's for dinner?
I didn't realize you lived so close. That's great.
Well, I don't, but Dr. Spaniel,
Yeah.
they're just like 5 minutes up the road.
Oh,
So
sweet. Okay,
yeah,
perfect.
usually just hit my sister, being like,
Hi.
surprise.
what are you having for dinner?
So let's see. So I have a boy in college who's a senior, and I have a boy who's a high school senior too. And so he's still at home with us, and so he's always coming and going. But this weekend we made a butternut squash
Yeah.
recipe. Have you guys done anything with that? So
Was it like
Like a
soup
spag-
or was it
no,
like the
it was
chunk?
yeah. You kind of cut it up in
Cubes,
and then
yeah.
we roasted it, and then I think we had some ground turkey and some. So it was like a kind of a Korean flavor, So
Yeah.
leftovers, and so that'll go as long
It's
as we can keep
Tuesday,
it.
though.
Yeah,
Taco Tuesday. That's what you should
it
tell
is. It
Ash
is.
to make
It
you.
is Mexican. So,
That's a good point.
um, any last minute thoughts you guys have for our patients thinking about breast surgery at all? We covered an awful lot of stuff.
Yeah.
Um,
I would say that there's a lot there's a lot of different shapes of breasts naturally out in the world. So if something's bothering you or we've seen it all. Like if you think like no problem's too small or nothing's too big, and we can make them smaller, we can make them lifted, we can make them bigger, we can change the size of your areola. That gets actually brought up a lot.
Yeah.
People are like, well, or can you change that? Of course.
That's true.
That's a big thing
that does come
that we
up.
do, especially with lifts, a lot. So yeah, there's
Yeah.
a wide variety of breasts out there, and
Yeah, it's intimidating to come to a plastic surgeon, I think,
Right.
and or any of this kind of stuff, particularly, getting undressed, and we're going to, be looking and measuring and photographing and stuff like that.
Folding,
It's
yeah.
and yeah,
Yeah.
I mean, just it's because we're sort of tactile and we're trying to
Yes.
figure out how things might go in surgery and stuff like that, and so we get that. We of course never want to be intimidating, but
sure,
yeah, like Dr. Sampath said, come see us, and I'm sure we can at least give you some options. And sometimes it's what, don't have surgery right now,
yeah,
or it's not the right time or something like that. But oftentimes, things we can do to help. So,
I agree.
well, this is a pretty good coverage of cosmetic breast surgery today. We're sure glad you joined us today. Please come see us for a consultation. Any of the 6 surgeons we've got. And we'd love to meet you and go over your options for you. So thanks so much for joining us. And thank you, Katie, Dr. Sampath. Thanks for
Thanks.
joining today. We'll see you guys next time. Bye.
Bye.
Bye.